Hi everyone, so this is the sixth video in the series on overcoming insomnia using the cognitive behavioral therapy for insomnia, a completely natural way of treating insomnia. So in this video I would like to mention some add-ons or bonuses to the material I presented in the previous videos. And they stem from my own experience with working with certain treatment protocols. So cognitive behavioral therapy for insomnia is based on a protocol that was used in a research study. So a protocol is a very specific method of applying certain kind of treatment to people, and the reason why protocols are designed for research studies is to make sure that research studies are then valid, so that it is easier to say whether such specific treatment was effective and was responsible for improvement of a certain condition. So that's true for cognitive behavioral therapy for treating insomnia. Why I mentioned protocol is because I want to encourage you to have flexibility with applying this protocol. Protocols tend to be quite rigid, and that's the way they are, and they are designed to be rigid precisely for the purpose of research studies. But that doesn't mean that if you modify a protocol just a little tiny bit, that it's not gonna work for you anymore. Working with the protocol in a daily life can be quite, it grows old pretty soon. And what I notice is that if you are using all of the techniques and methods that we discussed for treating insomnia and for making sure that you sleep better, what may happen is that you may start worrying about using this protocol correctly. Right, so I just wanted to encourage you to be flexible and to forgive yourself just in case you don't put your electronic device aside exactly at the moment when you're supposed to, or if you had a nap longer than 20 minutes during the day, or you didn't go to bed at the time that you were supposed to go, or you didn't exercise during a day, or maybe you had a cup of coffee in the second half of the day. It can be difficult in the sense that you may then blame yourself, so please don't be hard on yourself. It is not that simple and not that easy to follow all of these recommendations all at once, and I would say that this is an art rather than a science of making sure that you sleep well in case you have problems with sleep. So I wanted to encourage you to have some flexibility with the protocol, and to be compassionate toward yourself and forgive yourself just in case some days you're not able to follow this method to the T, right? Because if you are a little bit more flexible and more forgiving to yourself, chances are that you're going to stick with this method for a longer period of time, and overall is going to have more positive effects on you. So don't add on to your negative thinking about sleep. If you think negatively about how well you follow this cognitive behavioral therapy method for treating insomnia, if you worry about that in addition to all of the other things, you don't want that to affect your sleep negatively. So flexibility is one thing. The second thing that I wanted to mention is to encourage you to be your own scientist. So if you really track how well you sleep and what things you do during the day, so if you just have a journal and every day you write, so this day I had that many cups of coffee, I exercised for this long, I had a meal this late in the evening, all of the things that you know from the previous videos that might affect your sleep, if you track them, just non-judgmentally, just observe. And then you write down how well you slept. So again, the things that we discussed in the video that is dedicated to sleep log. So if you track all of those things, you'll be able to see what helps you to sleep better and what doesn't. And you are going to be able to fine-tune this technique of cognitive behavioral therapy for insomnia, and maybe other things that you discover for yourself by doing your own research, and you will be able to come up with your own method that helps you to sleep better. All right, so the first thing is flexibility. The second thing is, what was that? Be your own scientist. So track how well you sleep and what you do, and be your own scientist. The third thing that I wanted to mention, I already mentioned it, self-compassion, but I think it deserves to be a separate point. So every treatment, everything that we do, every treatment of this kind that is based on some kind of protocol, it tends to lose its effectiveness if we are not able to be self-compassionate, because you can take any method, any treatment, and if you do not have self-compassion, you can turn it into an instrument of self-torture. So if you're losing all the fun in your life because you're trying to do cognitive behavioral therapy for insomnia, then maybe it's not such a good idea, right? So you do want to be persistent with this method, and you do want to follow the protocol as closely as you want to in the beginning, just so that you know in the initial stages what helps you. But as the time goes by, you want to make sure that you are self-compassionate. And I wanted to share one exercise in self-compassion that you may want to do. So you imagine a newborn child. Just imagine a newborn child. And you imagine holding that child and how fragile he or she looks, and how you want to take care of it, and what you wish for that child in their life. And then just spend some time with that, imagining that. And then imagine that that child is you. And then spend 10 to 15 minutes giving yourself compassion. We are taught in our culture, and maybe throughout our entire life, things that we are supposed to do, emotions that we are supposed to feel. Don't cry, or kiss this uncle, or finish your plate, clean your plate, or for girls that maybe when you're wearing a skirt, keep your knees together, and all of this kind of stuff. The things that we are supposed to be doing, the things that we should be doing. And even though we are naturally born with self-compassion and self-care, and we naturally usually are born with feeling our gut feelings and expressing our feelings. Gabor Mate, he's one of the things that he repeats in his lectures. Try to find an infant who doesn't express their feelings. It would be pretty much impossible to find an infant, and yet through our lives we learn how to ignore our needs, we learn how to ignore and suppress our feelings, and we learn how to not take care of ourselves. So self-compassion is a very important portion of applying any protocol or any treatment and any kind of healing. And so I just wanted to encourage you to practice it. And so, okay, let's repeat what I told you, 3 things already. So do you remember what was the first thing? Flexibility. What was the second thing? Be your own scientist. The third thing was, do you still remember? I just mentioned it. Self-compassion. And one more thing is that insomnia it's a complex issue, and it often might be an issue that's related to some other chronic or acute illness. So I wrote a list of other health conditions that may affect how well we sleep. So pain, whether it's acute or chronic pain, in particular arthritis, depression, anxiety, PTSD, restless legs syndrome, sleep apnea, incontinence, These are just a few examples of other health issues that may affect how well we sleep. So if you are not successful with addressing the difficulties with your sleep by using cognitive behavioral therapy for insomnia alone, you may want to consult a doctor or somebody who is specifically trained in specific health issues that you're experiencing, how to address those issues. And so what usually is the case is that a secondary health issue or the primary health issue, depending on how you want to look at that, it affects how well you sleep. And then on the other hand, there is a feedback that how well you sleep, it affects that health issue. So these things are related, and so sometimes you cannot treat one or the other separately. And so you may want to consult a doctor. And if you do not know if you have any other health issues, you may want to ask your doctor. There are things that are called sleep studies, but that's something that can be done to determine better some additional issues that may be affecting your sleep. So that was the first thing, was explore any other health issues that you might have that may affect how well you sleep. So let us repeat together one more time. 4 things we discussed in this video. 1 is flexibility with how you apply cognitive behavioral therapy for insomnia. 2nd thing, do you still remember? Be your own scientist. 3rd thing is have self-compassion. And 4th thing is explore any other health issues that you might have that may be affecting your sleep. And so these 4 things that we discussed in this video, they're actually good in general, for your self-care. So I hope you enjoyed this video. This is the end. This is the 6th week of the 6-week challenge on improving your sleep. You can continue to track your sleep. All of the videos I mentioned are linked down below, so in case you haven't seen them yet, you're welcome to check them out. And also, I'm curious what other things you would like to be discussed in this channel. This channel is dedicated to self-care for body, mind, and spirit. So I'm curious what other things you'd like to be discussed. Please leave a comment below. If you like this video, please give it a thumbs up. Please subscribe to my channel, and I'll see you next week with a new content and a new video. Bye.